Good evening and welcome to Physio Tips with Marrow. I'm your host, Marrow Burnette. And as always, I have a question for you. Are you a headache sufferer? Do you get neck pain? Do you sometimes get pain in the back of the head and it radiates around, maybe around your eye or behind your eye? If you answered yes to these questions, then stay tuned. In this video, we're going to give you 3 must-see tips on how to identify if you are a cervicogenic headache sufferer. All right, let's get into it. Let's give a good working definition of cervicogenic headache. Okay, by definition, cervicogenic headache, cervical spine, our neck, genesis, the beginning of, so the headache is beginning in the neck and radiating off to the head. At the base of the head here, we have the C1 vertebra, the C2, and the C3. The upper neck is very neurally sensitive. It connects to a lot of nerves that provide sensation off to the head and the face. One of those nerves is called the occipital nerve. The occipital nerve radiates to the back of the head, can cause a lot of pain in the back of the head, maybe even near the top of the head. It's pretty nasty. Okay, another nerve that can radiate pain into your head and face is called the trigeminal nerve. Trigeminal nerve has 3 branches. One branch that goes to your forehead, another to your sinus cavity, and a third to your jaw. Do you get the headache sometimes and it's around the eye or in the forehead, or maybe into the sinus cavity, or even tightening your jaw muscles? That could all be part of this cervicogenic headache disorder that we're talking about. Maybe you've made it to ear, nose, and throat to see what's wrong with your sinus cavity. Maybe you've made it to the neurologist for this pain in the head, make sure that it's not something terrible. Or maybe you made it to the dentist with chronic jaw tightness. This is a common scenario when you're suffering these cervicogenic headaches. All right, let's talk about the presentation of a cervicogenic headache. What is it like? Oftentimes, when you read about it in literature, you'll hear about the cervicogenic headache sufferer having pain mostly on one side. This is true. Oftentimes, my patients will tell me it hurts in the base of the head right here and it kind of radiates around. However, it can definitely switch sides. It can be worse on the right side, but sometimes it's on the left. Sometimes the whole head could hurt. So the presentation can vary a little bit for sure. Sometimes it might even trigger a traditional migraine where you now have light sensitivity and sound sensitivity. You might be very sensitive to the barometric pressure changes. Remember, when the barometric pressure changes in a storm system, then you're going to have increased pressure on your cervical joints. If your joints are already on the edge of being sore, that extra barometric pressure change could be enough to push it over the edge and trigger a headache. Okay, so that's a good working definition of cervicogenic headache. Thanks everyone for watching, and this is that time of the video where I just want to say, if you're enjoying the video, if you're getting something out of it, do me a big favor, hit that thumbs up. If you want to subscribe to our channel, you'll get all of our latest videos on physical therapy related tips to help you with your musculoskeletal problems. And don't forget the comment section below. We love your comments. We'll be glad to answer them as best we can, and we appreciate it. All right, let's get back to the video. Thanks. Hey, let's talk about something that I'm passionate about, forward head posture. All right, I've got my friend here. This is an 8-pound medicine ball. It feels kind of heavy. It's heavier than it looks. All right, forward head posture is the scenario where you're sitting at your desk, you're at your computer, and your head's kind of forward, right? We've all done it before. You're working on your computer. All right, the head could be 10, 12, maybe 13 pounds on average. This guy's about 8 pounds, so we're going to pretend that it's pretty close. However, let's think of it this way. For every inch that you bring your head forward, add about 10 extra pounds of stress to the back of the neck. So picture this guy. We're going to wrap it in a big sturdy sack, and I'm going to hang it around my neck. And for every inch that my head's been forward working on the computer, this is what my neck's experiencing. 10 extra pounds of pressure pulling on your neck. Doesn't look comfortable. It's not. Okay, so that's forward head posture, a great trigger for cervicogenic headache sufferers. All right, so now we've talked about forward head posture. Let's talk about the 3 tests that we're going to do to test for cervicogenic headache. Okay, test number 1, cervical range of motion. Let's take a look at this. Okay, to start with, we're going to start with rotation of the neck. Here we go. I rotate my neck to the left as far as I can comfortably. Does it feel sore? Do I feel tight? Does it reproduce a headache? I'm thinking of this data, right? Now I rotate to the right as far as I can comfortably. Does that feel sore? Is that painful? Now I've got that logged in, cervical rotation. The next thing I'm going to look at is bending your head forward and then bending your head back. Does one feel better or worse than the other? In a normal situation where the neck's doing pretty good, you shouldn't have much discomfort in any of these tests. However, if you do some of these tests and you notice you do get pain or discomfort, then that's a positive for our first test for cervicogenic headaches. Also, we can test side to side, a little bit into the side bend, and we can gently go into the other side bend. Now, let's look at a couple tests specific for your upper neck. As we mentioned before, cervicogenic headaches is usually a problem with your upper neck. Okay, if I take my chin and I gently go back, it's kind of flexing the upper part of my neck, or testing the ability to flex of the upper part of my neck. Oftentimes, people with that forward head posture we mentioned earlier, the muscles will become very tight in the back of the head. And when you go to do this, you might feel, wow, that's really tight and painful. Matter of fact, if I keep doing that, it might give me a headache. That's definitely a positive for cervicogenic headache. Another way that we could test the upper neck is extending it or compressing it. To do that, we're going to do the opposite. I poke my chin up and out at a 45. It really compresses the upper neck. Does that cause pain? For my patients, when they come in for examination, I want to be able to tell, does one or the other provoke their neck? Oftentimes, I would say more often than not, it's especially this chin end thing. People are very tight here. So that's going to be test number 1, cervical active range of motion. All right, let's get into test number 2. Okay, let's talk about test number 2. Test number 2 is going to be called the cervical liftoff test. We can do this very easy. We lie you down on your bed, you're lying on your pillow, you tuck your chin in a little bit while you're lying on your pillow, and then you begin to lift your head off of the pillow, maybe about that much. What we're going to look for is, can you hold your neck for 10, 20, 30 seconds? Is it shaky? Is it uncomfortable? Does it elicit pain? Okay, any of those would be a positive. In a poor test, you might find 5 seconds or less, immediately your neck starts to shake, it feels uncomfortable, and you're thinking to yourself, this could cause a headache. I better put my head back down on the pillow. Okay, if you try this at home and you do experience that pain, don't torture yourself. You've already got a positive, put your head back down. But a great score might be 20 or 30 seconds. Man, this is easy. I can hold my head up all day long, call my friends, see how we're doing, okay? There was a study done in 2002, and they looked at 200 people that hurt their neck in car accidents, and they now suffered headaches. So they looked at those 200 people, and they had 50 people in a control group. They brought them in, and they had a device that measured pounds per square inch. So the headache sufferers, they had them push their forehead into this device, and they were 50 to 75% weaker than the control group. Okay, then they had them push back to measure, and they were 50% weaker than the control group for the back of the neck. All right, so here's my example again. Here's this heavy head, here's my neck, and now I'm going to take 75% of strength away from the neck from the front and maybe 50% from the back. I just had a patient the other day. They were working out in the gym. They pulled the bar up, bam, smacked their chin. Their neck was really sore for 24 hours. By the time they came into clinic, I laid them down and I tried to ask them to lift their head to do that liftoff test. They couldn't even lift their head 1 inch. They had to use their hand. Their neck was so sore and their muscles were so inhibited. So that's going to be our classic liftoff test. Okay, in just a second, I'm going to hop on a mat and I'm going to show you how to do it. All right, let's get to it. Okay, here we are. We're ready for the liftoff test. This is how it's going to work. I'm lying back on my pillow. You can do this in your bed, on your couch. You tuck your chin in a little bit. Then we're going to lift your head and we're going to look to see, can you hold it 10, 20, 30 seconds? Does it cause pain? Does it cause discomfort? Do you feel like it's going to elicit that headache? If it does, there's your positive. It's a simple test to do. Lie down, lift up, and see how you do. All right, guys, that's test number 2. Stay tuned. We're going to get into our final test number 3. Okay. Let's talk about test number 3. Test number 3 is palpation of the upper cervical spine. What do you mean palpation? Palpation is kind of like touching, right? You're pressing into the muscles or into the joints to see if we can provoke them. We're looking to see, does that elicit discomfort? Is it worse one side versus the other? Does it elicit your headache? Any of those would be a positive. So here's my spine over here. If I press into the right side Gentle but firm, actually that's the left side, or the right side on this side, right? And then maybe come down an inch or so. Now we're gonna be into C2, a little bit into C3. Does that elicit symptoms? Does that cause that pain that you get that radiates around the eye? If so, that's a positive. All right, you can do it on yourself right now. Take your hands, run down the back of your head, gentle but firm, press into the right side. How does that feel? Is it normal? It just feels like a touch? Or is that kind of sensitive? How about the left side? Normal? Or does that feel sensitive? If you tested positive, then guess what? That's your third positive. Did you test positive for the cervical range of motion? Remember that one? Right to left, up and down, maybe tuck the chin in. Okay, then that's positive number one. Did you test positive for the lift-off test? Tuck your chin in, lift your head, hold for 10, 20, 30 seconds. Okay, and then finally our third test, the palpation test. Randomized controlled trial research show if you've tested positive for all three, guess what? You may be a cervicogenic headache sufferer. Okay, let's go with a scenario that maybe you're a long-time headache sufferer and you've gone good medicines, maybe you see a neurologist, the medicine's helping for sure, but you're still having 2, 3, 4 headaches a week. Okay, in that scenario, I would say sit down with your healthcare provider, talk to them, say, hey, you know what? I saw this video on Facebook on cervicogenic headache tests and I tested positive for all three. Is it possible that I'm a cervicogenic headache sufferer? And if so, do you know of a specialist physical therapist in my area that I could hook up with, right? If you get with the right person, if they use the right program, it could be really helpful. I definitely would recommend not just maybe your everyday around the corner PT, but get with someone that has a long history of specializing in these disorders. At our clinic here in Jacksonville, Florida, we have patients come from all over Florida, even out of state, because this is something that we specialize in. Okay, so there's 3 tips for testing for cervicogenic headache. I hope you enjoyed that. Thanks a lot. Thanks everyone for tuning into our video on 3 tests for cervicogenic headache. I hope you enjoyed it. I hope you got something out of it. Do me a big favor. If you have a friend, a loved one, a family member, hit that share button below. Send the video over. It might do a lot of good. Our goal is to get the message out to as many people as we can. Thanks so much again. Remember, if you want to get more videos like this, hit that red subscribe button below and you'll be able to get all of our upcoming videos. We greatly appreciate you guys and good luck taking care of that neck of yours. Bye-bye for now.